Hi, I'm Dr. Chris Nussbaum with Insight Life Care Concierge Medical Centers. Today is April 28th, 2020. It's estimated that approximately 3 million individuals worldwide are infected with SARS-CoV-2, and unfortunately by this evening, 1 million of them will be here in the United States. All over our country, governments are easing restrictions that were designed to try and suppress the transmission of the virus and the number of cases. Unfortunately, that's happening long before the mitigation techniques that are designed for that have actually been fully effective, and long before the testing requirements that were outlined by the federal government and other public health authorities have been achieved. It seems as if the rush to return to economic normalcy has allowed many people to just look away from the realities of the transmissibility of this very virulent virus. Testing is the linchpin to understanding how to slowly but surely return to economic normalcy. But testing has been difficult to achieve in many places. Up till most recently, the only way to get a coronavirus PCR test, the acute test that tells you if you have the infection right now, was if you were very sick, had symptoms, and most likely in the hospital. Hillsborough County has had very, very limited testing available. I checked with the Emergency Medical Services Director this morning, and there are 4 centers in the county that are now doing nasopharyngeal testing, but how long that will last is unclear, and there's no guarantee. Antibody testing has been made available all across the country by over 90 laboratories, and the Food and Drug Administration allowed these tests to come into the public domain without validation and testing because of a desire for speed. We use a fingerstick home test that you can have in your home, kind of like what you would do if you were checking a blood sugar, and that's available to you instantaneously. You can send the results off. We get a validated result from the laboratory within about 48 hours. We're using a Boston-based laboratory that's FDA certified and ISO certified. The PhD that runs the lab is from MIT and seems like a legit person. We think these are useful data that will help you understand whether or not you've been exposed to the disease, developed antibodies to it, and might have a degree of immunity. That kind of information can potentially be very helpful in terms of you returning to normalcy, especially when individuals around you may be forcing a reduction in your social distancing. I'd suggest very strongly that we chat about it if you have any interest. And in the meantime, don't let up. Keep your foot on the accelerator. Maintain your social distancing, your hygiene, and your 6-foot rule. Wear a mask when you go outside. It's not yet time for us to back off 100%. If you take a look at what's happening during the task force meetings that are publicized on TV, both Dr. Birx, Dr. Fauci, and other learned individuals all across the country are pleading with both governors and individuals to maintain the mitigation efforts that have gotten us this far. It's expected that 74,000 Americans will die. While that number is fluid and keeps moving, it generally tends to move up. Don't be a statistic. Be smart. Maintain your social distancing and get some testing. If we can help you with that, please give us a call at Insight Life Care, 813-689-2961, or www.insightlifecare.com. I'm Dr. Chris Nussbaum, and I'll be happy to chat with you if you have additional questions. Please be safe.